Thank you for joining us. One of our major concerns in life is that of our health, and our guest today is the Chancellor of the Nova Southeastern University Health Professions Division, Dr. Fred Lippmann. His impressive professional credentials include his background as a pharmacist, an entrepreneur, a professor, and a state legislator here in Florida, and now he is leading the Health Professions Division at Nova Southeastern University. We'll discuss trends in healthcare and education following these messages. Joining us now is Dr. Fred Lippmann, Chancellor of the Nova Southeastern University School of Medicine. It's a pleasure to have you back on the show.
Thank you very much, except I would calmly, respectfully tell you that it's not the School of Medicine, it's the Health Professions Division, which has 8 colleges and 19 programs.
Well, I stand corrected, and it's been quite a while since I last had the pleasure of having you on a show.
Thank you. Good to be back.
What's new in your world of medical educational areas?
What's new? Well, I think education in general is going through a dramatic metamorphosis, if not a revolution. I think the application of new techniques, new attitudes by the public in accepting education, not necessarily in a building that has bricks and mortar, but through electronic means. But generally, the bottom line to a quality education is still the interchange between the teaching professional. In our case, it's usually physicians or pharmacists or dentists or other health professionals, and the student, because the direct correlation between having a qualified health professional is the mentorship and the ability to have clinical oversight directly by the academician.
How is technology influencing the efficiency in which you can teach?
Oh, it's dramatic. It's dramatic. For example, in 4 of our colleges, starting this year, we will be using total pad type of devices in our classrooms. So there'll be direct interchange between the teaching professional and the pad information. We have been using in a 2 or 3 of our programs what generally is called e-books. In other words, we don't have textbooks. They're all uploaded through the corporations into our pads or into our laptop computers in some of our elements. But the whole efficiency of capturing education, keeping the knowledge in one place, not necessarily in your computer, but in the wireless and ether areas, and immediately capturing it for your utilization is dramatic. It's really changing the whole concept of education.
And of course, you can implement distance learning and immediately, constantly update your material.
Well, distance learning is something which was the basis. Your next guest is Dr. Abraham Fischler, who is one of the pioneers, the great pioneers in what I would call distant learning at the time, but they call it distance learning. But now that technology is involved, we use a great deal of what we call mixed modality. We have people that will show up in the classroom for 2 or 3 days or nights, plus learn online at their time and set period of time that they can communicate with their teaching professional.
Tell us, please, what more is unique about your school?
Unique about Nova Southeastern University? Well, I think one of the most unique things, and whether it's by happenstance or by the way that we were created, we're sort of an upside down venture when it comes to major universities. Don't forget, we are America's 8th or 9th largest not-for-profit private institution in the country with over 28,000 matriculants. So we're very large. But we're 80% post-baccalaureate. In other words, we only have 20% undergrads and 80% post-baccalaureate students who are graduate students and first professional students. That's very unusual. So What does that mean to the public or the people that are viewing the show? It means that what we're doing, particularly in the Health Professions Division, we're providing what has been designated by, whether you read the Wall Street Journal or Bloomberg News or whatever it is, as the greatest need for educated individuals are in the fields of healthcare over the next 2 decades in the United States. So we feel that we're answering that call. So what is unique? What is unique is that we've been very forward-looking. We didn't stay in the mold or the cast of, shall we say, some of our wonderful sister schools. I mean, I'm a graduate of Columbia University, as Dr. Fischler is in one of his ventures in education. But we're different. I mean, we're different because we have smaller classes, we have a lot of one-on-one teaching, and we have this great venture of, like I said, graduate study programs.
Sir, I once had the pleasure of interviewing Dr. Robert Mendelsohn, who I believe was the president of the American Medical Association at one point, and then to the astonishment and horror of the medical establishment, he wrote a book entitled Confessions of a Medical Heretic, basically disagreeing with a lot of what occurs in the medical field at the time. What are your thoughts with regard to being open-minded in general in education with a view to alternative medicines and alternative healthcare?
Well, firstly, I don't know. The word alternative is not, I really think of complementary, alternative, integrative, complementary, all being the same. But really what it really gets down to is that the people who are viewing your show want one thing. They want a longer life. They want a life where they have some feeling that they can be independent and that they can depend upon the healthcare system to give them that longer life and independence. I think that the minds of all healthcare professionals, not only physicians, but the dentists, pharmacists, optometrists, nurses, etc., the PAs, PTs, OTs, you name it, they all have learned that they have to work with one another. So in essence, they are complementing each other, and they're integrating into each other's profession the knowledge of that other specialty.
The best of both worlds.
It's more than the best. It's 1 and 1 doesn't equal 2. It's sort of 1 and 1 equals 8.
Speaking of other theories, I was asked to present you with this book as a gift. Bill asked me to give this to you, and you may find it interesting. The more thought, the better.
There's no such thing as controversial.
You have an interesting background. You were in politics. You started as a pharmacist. If you don't mind, share with our audience some of your experiences.
Well, do you have about 3-4 hours we can talk?
We do.
Well, firstly, I'm a product of I'm a first-generation American. I come from proud immigrants from Europe. I was educated in the public school system of New York City, and then I had the privilege of attending Columbia University. I then went on to the College of Pharmacy. I was a pharmacy professional from 1960 to about 85, 86. To be candid, I was rather successful in my ventures. But in 1978, I also took it upon myself, not for any glory, but because I wanted to do some things to change the policies. I ascended to a position of being a member of the House of Representatives in the state of Florida. Now, don't ask me why I stayed for 20 years. I can't tell you. But I feel very privileged that I did have that period of time. I still was gainfully employed wherever I was. I worked. I owned my own pharmacies. And then after I sold my pharmacies, Dr. Morton Terry, who was the founder of then Southeastern University of Health Sciences, came to me one day and said, "Why don't you do something worthwhile?" And he asked me if I would put together an opportunity and an overview of the possible creation of a college of pharmacy. So that began my educational career. Then after doing that, I had also the privilege of being one of the 4 people that were the merger team that put Southeastern University together with Nova University and became Nova Southeastern University. So from there it goes on. I found myself going back into the classroom and going to that wonderful school called the Official School of Education to get my doctorate degree. That was probably one of the most frightening things that ever happened to me, because I had not been in a classroom in over 30 years, and here I was back in a classroom. Took 7+ years, but I guess it was worth it. And that's the short history. Richard, there's one thing that I want to just add to as a sort of a postscript as to what I just said. You said that I was a politician. I really never viewed myself as a politician. I really viewed myself really as a community interest leader, because all of my prior years to the time that I went into elected office, I did things like I sat on the South Broward Hospital District Board of Commissioners. I was chairman of the Broward Charter Study Commission, things of that nature, which I did not because I needed to do it for the purposes of inuring benefits for myself, but I really felt a responsibility to basically my customers and the people that I lived with and walked with throughout life. So that sounds very ecumenical and very white hatish, but that's the reality. So very few people at that point in time could sort of point at me and say, "Oh, you're one of those. You're a conservative, you're a liberal, you're a Republican, you're a Democrat." I don't know. I don't think that people really looked at me that way, at least in my observation. I don't think so.
Well, there's so many labels in our world, unfortunately, and there should be more cooperation. And of course, that brings me to the word research. It so happens I'd like to convey greetings from Baroness Susan Greenfield of Oxford University. I'm going to see her next week, and she's interested in what you're doing here at Nova, and she's involved with Alzheimer's research. She's a neuroscientist leading a research team. But what are your thoughts with regard to innovation, medical innovation, healthcare in the future?
I think what's happening now in healthcare is it's going so fast. It's not just geometric increases in knowledge. It's jumping so quickly, and that's because of, to tell you the truth, the ability of technology and computer capabilities of helping the human intellect decipher everything very quickly. We had the math geniuses of yesteryear that used to use slide rules, but it would take time, whereas a supercomputer can make those determinations in nanoseconds, and it's very, very helpful. But with reference to research, Nova Southeastern University is on the cusp of becoming a major research powerhouse. We're going to be breaking ground in September of the largest collaborative research building in the state of Florida. It's a 220,000 square foot building that will deal with everything from neurologic disease issues to cardiac issues to the environmental issues. It will be a huge boon to the research community of the world, because the research community is no longer just centered in one institution. Because of the ability to interact and communicate with other scientists around the world, the Baroness could be talking to our people not, one-on-one in the same room as if she was sitting across the table. So that, and the exchange of information in a secure type of transmission is very, very important to scientists, and we will have that capacity here at Nova Southeastern University.
It's all about teamwork. Thank you so very much for being with us today, sir.
Thank you. I appreciate being here.